Hey guys, this is Dr. Hub. Today we are going to look at the composition of the human semen. So first, what is the sperm count? The sperm count of the human semen, it is about the average about 100 million. So it is 100 million per ml. So with there is about less than 20% of the abnormal form. Next is a question on the pH. What is the pH of the semen? It is 7.35 to 7.50. So what is the specific gravity? The specific gravity is 1.028. Now the question arises on the components. So what are the components? And this will be from the seminal vesicles. So we are calling it SV, that is the seminal vesicles. So this, what we need to know is constitutes about 60% of the total volume. So 60% of the total volume. So what are the components of the seminal vesicles? So this is important. Seminal vesicles, it constitutes of, it is fructose. So it contains fructose. Next, it contains the phosphoryl choline. Phosphoryl choline. Next, there is also presence of the ergothioneine, and there is ascorbic acid. There is also the presence of the flavins and the PGs, that is the prostaglandins. Now, before we move ahead, let's just look at the color. The normal color is white and opalescent. So it's white and opalescent. Now getting back to the components, we are looking at the components of the prostate now. So in terms of the components of the prostate. So the prostate, it amounts to about 20% of the volume. And what does it contain? The prostate, it contains spermine. So spermine. Then there is 2 C's which are present. One C is for the citric acid. So citric acid. Another C is for the cholesterol. So there is cholesterol, and the phospholipids, we are writing it as PL. Then there are 2 F's. F stands for the fibrinolysin. This fibrinolysin, as well as the fibrinogenase. There is fibrinogenase. Next is we look at the zinc. Z for the zinc and A for the acid phosphatase. Now we move ahead with the buffers. So what are the buffers? So under buffers, it includes the phosphate. So buffers, we have the phosphate. Next is the bicarbonates. So bicarbs. And there is also the H for the hyaluronidase. So there is hyaluronidase, and M for the magnesium. So M for the magnesium.